It was great to see so many of you at CHPA's annual executive conference in Florida a couple of weeks ago. For those of you who weren't able to attend, however, I did want to share some highlights of the meeting as really exciting business was conducted over those few days. First, our board of directors met for the first time this year and approved a leadership agenda for dietary supplements that will guide our work in this important category in the months and the years ahead. Our membership voted 5 new members onto the board of directors, and I want to thank those 5 individuals for stepping up to serve the industry through their service on CHPA's board. We also conducted our first ever Women's Leadership Forum event. It was incredibly well received, and look for more of those in the future. And finally, we had 2 days of just amazing educational content that focused on leadership and trust and evolution, all really important themes for today's business environment. We also took the opportunity of this year's annual executive conference to release important new research that updated research that we first conducted in 2012. And that's research that shows the economic value of OTC medicines to the U.S. healthcare system. Our researchers modeled what consumers would do if OTCs were not available. And they found that they would go to the doctor, they would get a prescription, or they would tough it out and suffer the consequences like lost productivity at work. Each of these scenarios comes with enormous costs, and the researchers released that data at our AEC this year. And here's what we found. First, by reducing unnecessary visits to see the doctor, OTC medicines save the U.S. healthcare system nearly $95 billion each year. Second, by reducing reliance on more expensive prescription drugs, OTC medicines save the U.S. healthcare system nearly $52 billion each year. Together, this equals $146 billion in savings per year. That's $40 billion more in annual savings than we found in 2012. You can get a copy of our report and all the accompanying infographics by going to our new microsite, overthecountervalue.org. Now, we're going to use this data in a lot of different ways moving forward, but we're using it already in support of H.R. 1922, legislation that was introduced in the House of Representatives just last week to restore the ability of consumers to use their HSA or FSA to purchase over-the-counter medicines. As you know, that right was taken away in 2011 as one of the first enacted provisions of the Affordable Care Act. Armed with this data, we can now tell the story that restoring access to HSAs and FSAs for over-the-counter medicines is not just good health policy, it's good economics. As we work together to grow self-care, we look forward to working with you, and please don't hesitate to call on us if we can ever be of assistance.